South Anchorage. My special focus and training is in cardiac anesthesia, and I'm here because it disturbs me that the mayor is proposing a public masking mandate. Such breaches of personal freedom and self-determination should only be considered for public health policy intervention in extreme circumstances where there is compelling data that such interventions will merit the violation of the public's rights. To be clear, I'm not against wearing masks. As an anesthesiologist, PPE is my life. I wear masks daily in the operating room, or advanced PPE such as PAPR hoods for intubation of known COVID-19 patients. In fact, when the initial reports of the aggressive virus emerged from China, I did my own literature research, and my pre-med studies were in biology, cell biology, immunology, and I was troubled that the coronavirus was altered in gain-of-function research, which made it more pathogenic and transmissible to humans. At that time, late January, I personally bought P100 and N95 masks for my entire family. And when the pandemic was finally declared and cases came to Anchorage, I moved out of my house, self-quarantined, so as to not bring back the virus to my family from the hospital. They have high-risk things, heart disease, mitochondrial illness, etc. However, when the hospitals remained empty, half census and the ICUs never filled up, if the virus was shown to be less fatal than initially believed, I moved home. And now the family and I simply practice good hand washing and don't touch our faces. We adjusted our behavior as the data has changed. And in the same way, this assembly needs to adjust their behavior and see that the governmental intrusions on personal rights, businesses, and religious organizations must cease. COVID-19 is not destroying our city by disease, but instead by the preventative policies that have been installed that are now no longer needed. In fact, as of the end of May, Alaska's own DHSS published the data on deaths by cause, comparing deaths in 2020 to deaths in 2017, 18, and 19 online. And as of the end of May, less Alaskans died of all cases of influenza, pneumonia, or other respiratory illnesses, including COVID-19, than the average deaths for the last 3 years average. Experts in the world are thinking that COVID appears to be weakening in terms of virulence, likely due to mutations, and deaths in the USA are slowly, commensurately reducing as well. Quarantine of COVID-positive patients and voluntary quarantine of the at-risk population is effective and advisable, but without good data and consensus with such low mortality numbers, this assembly cannot justify lengthening emergency powers for the mayor and definitely cannot support mandating public masking. To make a comparison, automobile-related deaths have been reduced in 2020 as well, likely due to lockdown. Motor vehicle accidents are significantly a public health problem. We could use the same logic and say, okay, from now on, there's no nighttime driving, except for essential workers. Death rates would fall, less innocent people would die, but freedom would die as well. It is definitely not worth the price of unconstitutional overreach. Finally, even though children remain at extremely low risk, they are also being seriously adversely affected by the effects on the Anchorage School District. They're following your all's lead. I have special school children. They're not getting good care.
Sir,
Half time. Thank you, sir. I appreciate your all's time. Please act accordingly.
Thank you.